Hi, I'm Dr. Justin Paul. I'm an orthopedic spine surgeon working with Ortho Connecticut. Now, whenever someone has to have spine surgery, there's a lot of questions. And I can't answer all of them, and mostly that's because everybody's a little bit different. But I can give you some, estimates about what to expect after your surgery. So for a surgery on your neck, so a lot of times neck surgery is done through the front, and it's done through a small incision about this big. You probably notice, and please don't do this at home, but if you push hard enough, you can actually even feel your spine because it's the hard bone behind very soft structures here. That makes the surgery a lot easier to tolerate. So there isn't really a ton of pain after this kind of surgery. The most important thing to expect after that kind of surgery is some hoarseness in your voice, maybe a little difficulty swallowing because your food tube and your breathing tube are right there and I have to push them to the side. Let's say nudge them to the side. The idea is you will have those kinds of experiences, but overall your pain after anterior cervical surgery is not so much. I do have to warn you, sometimes that's not the right surgery for you, and the surgery has to be done from the back. And I tend to warn people, it's going to hurt. It does hurt to have the surgery because there are some strong muscles back here to keep your head up that I have to push out of the way. And that hurts. But post-operative pain always goes away with time. How much time is really up to your, the size of the surgery and what needed to be done and your experience of pain. Everybody's a little bit different. Most people don't have pain much more than a couple of weeks after the surgery. So when it comes to rehabilitation, I tend to not do too much physical therapy after the surgery. Usually we've tried lots of physical therapy before surgery to try to fix it with natural healing. What might happen though is if you had weakness before the surgery, after you've recovered a little bit, we'll start some physical therapy several weeks later. And then they can work on strengthening and stretching and getting you back to the Olympic athlete you once were. So a lot of questions come up about what do I need to do before the surgery. Most times not much, but it is important for you to talk to your primary care doctor in most cases so that they can make sure you're healthy enough for surgery and answer questions like, how long can I be off blood thinners, for example? Everybody should quit smoking before, after surgery. In general, you should quit smoking. Smoking will interfere with some of the things that we try to do in surgery, such as fusing two bones together. It's the nicotine, actually, that's the problem, because it constricts your blood vessels, and the blood can't feed the important nutrients to the surgery that we're trying to perform. Some people want to know whether or not to have family members nearby for recovery. I always encourage that. It's better in fact than going to a nursing home. Not just because of the pandemic, but it's great to have people who really love and care for you so that you can go home after surgery and be supported by the family.